Friend, I want to start this video with a very simple question. Has it happened to you that after age 50, you notice your body doesn't respond the same way in your intimate life? Maybe you've tried everything from expensive medications to miracle treatments that promise quick results, but in the end, you're left with the same frustration. And worst of all, besides spending money, you lose confidence in yourself. I know this because I've heard that same story in my office many times. Men tired of trying again and again. Men who arrive resigned, thinking there's nothing more to be done. And I want to tell you something very important. You don't have to settle for that idea. There are simpler, more natural, and above all, more affordable ways. Today we're going to talk about a vitamin that perhaps you've never considered. An inexpensive vitamin so common that you can find it in any pharmacy without effort, but one that plays a powerful role in your sexual health. I'm not talking about magic tricks. I'm talking about science, about what really works in the body, even though most men don't know it. Sometimes we think that only expensive pills can resolve erectile dysfunction, but the reality is that your body, your circulation, and even your nutrition have much more to say on this topic than you imagine. I want you to stay with me throughout this entire video, because I'm going to tell you exactly how this vitamin works, why it can make a huge difference, and what concrete steps you can take starting today. I'm not speaking from cold theory. For more than 18 years, I've seen many patients go through what you may be experiencing now. Some arrive dejected, even embarrassed to mention it, and little by little, with a simple adjustment, they regained their confidence, energy, and even joy in their relationship with their partner. So, I want you to think about yourself while you listen to this video. Do you recognize yourself in what I'm saying? Have you experienced those nights when you feel your body doesn't respond? If so, this message is especially for you. I want to reveal something that might sound surprising. The vitamin I'm talking about isn't a new medication or an expensive supplement only sold online. It's folic acid, also known as vitamin B9. You've probably heard of it in another context, almost always related to pregnant women, because it's recommended for the healthy development of the baby. And that's true. It plays a fundamental role there. But what almost no one mentions is that it can also be a powerful ally for men's intimate health. The first time a patient asked me about folic acid in relation to erection, I remember being surprised. It was more than a decade ago. This 62-year-old man had read a small scientific article and decided to try it on his own. When he returned to my office, he told me he had been noticing positive changes for weeks. More firmness, more confidence, and less frustration. At that time, I confess I was skeptical too. But I started investigating, reviewing studies, and what I discovered changed my approach to treating patients. Folic acid isn't just for pregnant women. It's essential for vascular health. And without good blood circulation, no erection can remain firm. I'm going to explain two main mechanisms with real and easy-to-understand examples. Mechanism number 1. Protecting the endothelium, the guardian of your arteries. First, let's talk about the endothelium. The endothelium is like a very thin skin that lines the inside of all your arteries, including those that go to the penis. When it functions well, it produces nitric oxide, the molecule that relaxes blood vessels and allows blood to flow. But there's a silent enemy called homocysteine. It's an amino acid that, when it accumulates in excess, acts like a slow poison. It damages the walls of blood vessels, making them fragile and less flexible. Studies have shown that men with erectile dysfunction often have 25% more homocysteine than men with normal function. Folic acid helps break down and eliminate that excess, protecting your arteries. Mechanism number 2. Stimulating nitric oxide production. Nitric oxide is like a key that opens the doors of your arteries. Without enough nitric oxide, arteries remain contracted, and blood cannot flow adequately to the penis. Do you know how Viagra works? It prevents the little nitric oxide you produce from being destroyed quickly. But folic acid does something better. It helps your body produce more nitric oxide naturally. I've seen cases where after 8 to 10 weeks of supplementation, patients who had almost lost hope started feeling firm morning erections again. And believe me, those spontaneous morning erections are one of the most reliable indicators that your vascular system is regaining vitality. A very interesting study published in the International Journal of Impotence Research showed that men with folic acid deficiency who received supplementation for 12 weeks reported significant improvements not only in the rigidity of erections, but also in the overall satisfaction of their sexual relationships. I remember a patient, I'll call him John, 58 years old. He had spent a fortune on Viagra, but he confessed to me, "Doctor, it works sometimes, but it gives me a terrible headache and I see everything blue. Isn't there something more natural?" I suggested the folic acid protocol. He looked at me skeptically. "Seriously, doctor? Such an inexpensive vitamin?" I asked for his patience. 6 weeks later, he returned and told me he no longer needed to use the full dose of the medication. His morning erections were more frequent, and above all, he felt more general energy. Another case is Michael, 65 years old, with a history of hypertension and diabetes. He was convinced his problem was irreversible. He started with the protocol of 5 mg of folic acid daily, and after 2 months, he told me something I won't forget. "Doctor, not only did my intimate life improve, I feel more energetic, less tired. My wife says I look 10 years younger." Not all men have the same level of deficiency risk. Let me explain who is more vulnerable. Men over 50 years old. From this age on, intestinal absorption is not as efficient. Even if you eat relatively well, your body may not be making the most of what goes in. Those taking heart or blood pressure medications. Many of these medications interfere with folic acid absorption. A patient I met had chronic fatigue and erection. Problems. When checking his folate levels, they were below normal. With proper supplementation, not only did his intimate life improve, but also his daily energy. Men who smoke or drink alcohol regularly. Tobacco and alcohol are direct enemies of this vitamin. Smoking increases oxidative stress and destroys part of the folate circulating in the blood. Alcohol, for its part, affects absorption in the intestine and accelerates elimination. Diabetics and pre-diabetics. Metformin, a common medication for your diabetes, reduces folic acid levels. Additionally, diabetes itself affects circulation, creating a double problem. I want you to pay attention to some signs that might indicate your body is asking for help. Constant fatigue without apparent cause. Difficulty concentrating or mild memory loss, irritability, and mood changes, loss of sexual desire. And of course, problems with erections. The interesting thing is that many men attribute these symptoms to normal aging when they can actually be signs of a nutritional deficiency. When they correct that deficiency, not only do their erections improve, but they also regain vitality, mood, and mental clarity. Now that you know who is at higher risk and how to identify the signs, let me give you the most practical part of all, the specific protocol. We're not talking about a preventive dose like the one recommended in common multivitamins. To improve erectile function, a therapeutic dose is needed. The amount I recommend to my patients based on scientific evidence, and my experience, is 5 mg daily. I want you to compare this with the typical preventive dose, which is usually just 400 micrograms. The difference is enormous, and that's why it's important not to settle for very low-dose supplements. When to take it? On an empty stomach, preferably in the morning with a glass of water. For how long? Don't expect magic overnight. Your cells need time to correct the deficiency and improve vascular function. It's normal to start noticing changes between 4 and 8 weeks of constant use. The protocol steps. Weeks 1 to 2. Your body begins to absorb and use folic acid. This is the phase of building reserves. Weeks 3 to 4. Gradual reduction of homocysteine. Your body starts cleaning the arteries. Some patients already notice more energy during the day. Weeks 5 to 6. Many patients at this stage already notice firmer, morning erections, or greater ease in responding to sexual stimulation. If you don't see changes, you can consider adding vitamins B6 and B12 because they work together with folic acid. Weeks 7 to 8. Optimize the protocol. If you notice improvements, continue. If results are limited, this is the time to consult with your doctor to evaluate other factors. Important warnings. Although folic acid is very safe, There are situations where you should be cautious. It can interact with some medications, such as certain anticonvulsants. It can also mask a vitamin B12 deficiency. That's why I always recommend that if you're going to take it for long periods, also include a B complex with B6 and B12. If you have a history of cancer or are using methotrexate, a common medication in some treatments, it's essential that you discuss it with your doctor before starting. How to enhance results. In addition to the supplement, include foods rich in folate, spinach, lentils, avocado, broccoli, oranges. Reduce alcohol and eliminate tobacco if possible. Each cigarette destroys part of the folic acid you consume. Exercise regularly. Physical activity improves circulation and enhances the effects of folic acid. Control stress. Cortisol, the stress hormone, is an enemy of erections. I'll tell you about Robert, 59 years old, a smoker since youth, who was convinced that age had defeated him. With the protocol, he reduced smoking and took folic acid diligently. 8 weeks later, he returned smiling and said, "The most curious thing is that my wife looks at me differently, as if she trusts me again." Another patient, Charles, 61 years old, commented, "Doctor, what surprised me most wasn't just the improvement in erections. It was feeling that desire again, that want that I thought was lost forever." What you should remember, folic acid doesn't work alone. It needs to be accompanied by a lifestyle that enhances it. A good diet, exercise, less alcohol, less tobacco, and above all, consistency. Perhaps you wonder, if it's so effective and so cheap, why has my doctor never mentioned it to me? The answer has several aspects. The first is that it's not a patented medication. There isn't a laboratory behind it investing millions in advertising or medical representatives reminding every doctor to prescribe it. It's an inexpensive vitamin that you can buy without a prescription at any pharmacy, and since it doesn't generate huge profits, there's no commercial interest in promoting it. The second is that many urologists are trained to focus on quick, more visible solutions. A medication that acts in 30 minutes is more impressive than a vitamin that takes weeks to show results. But I've learned over the years that the most important thing is not to give the quickest answer, but the most lasting one. Friend, we've talked about something that perhaps makes you uncomfortable to acknowledge: erection problems after 50. I know it can be a sensitive topic that many prefer to keep quiet about, but I want to congratulate you for getting this far, for listening, and for opening your mind to a different solution. I told you about a simple, inexpensive vitamin available in any pharmacy: folic acid. You learned that it's not a miracle trick, but an essential nutrient that your body needs to function well. We saw how it acts by cleaning your arteries of homocysteine, that silent poison, and how it stimulates the production of nitric oxide, the key molecule for erections. We identified who is at higher risk: those over 50, those taking medications, smokers, diabetics. And we recognized the symptoms: fatigue, irritability, lack of concentration, loss of desire. I shared with you a clear protocol: 5 milligrams a day on an empty stomach for at least 8 weeks, accompanied by changes in diet, exercise, and, when necessary, with other B-complex vitamins. I told you about real cases of patients who, with consistency and patience, recovered not only erectile function but also confidence in themselves and joy in their relationship. Now I tell you, it's not too late to recover your vitality. Your body can still respond. It just needs you to give it the right tools, and sometimes those tools are simpler than we imagine. If this video was useful to you, if you learned something new, or if it opened a door of hope for you, I invite you to do 3 very simple things. First, give the video a like. That helps me know that this content interests you. Second, subscribe to the channel so you don't miss upcoming topics on men's health after 50. Third, share this video with that friend who you know might need it. You don't have to tell him why, just that you found valuable information. And most importantly, talk to your doctor about including folic acid in your routine. Take this video if necessary. Your health is worth more than any embarrassment or discomfort. Remember, you're not alone in this. Millions of men go through the same thing, and many have found in this simple vitamin an answer they didn't expect. See you in the next video, where I'll talk about the 3 5-minute exercises that can further enhance these results. I'm Dr. Marina Hernandez, and my mission is to help you live better after 50. A hug, and see you soon.